Good day everyone, and thanks for joining me on today's episode of MRAID Talk Show. I am Dr. Joy. I have Dr. Mark here with me, and he will be talking to us about asthma. Ladies and gentlemen, Dr. Mark.
Thanks for having me here, Dr. Joy. It's an honor.
You're welcome. So Dr. Mark, can you please tell us about asthma?
Well, most people think of asthma as a disease that makes people cough and not breathe very well.
That's true.
But this is what actually happens during an asthmatic attack. Now everyone should take in a deep breath. I want us all to do this together. Now, I want everybody to take in a deep breath. Now slowly breathe out halfway. Don't breathe out completely. Now breathe in again. Breathe out halfway. Breathe in. Breathe out halfway. Breathe in. Breathe out halfway. Breathe in. Breathe out halfway. Breathe in.
Wow, that's not easy at all. So what's responsible for this difficulty with breathing?
The air we breathe in is not 100% pure every time. At times, it may contain some particulate matter, which can irritate our airway, causing us to sneeze or cough. Anything that irritates our upper airway will make us sneeze, while irritations in our lower airway is responsible for coughing.
That's correct.
The airway of patients with asthma overreacts to these irritants, thereby causing persistent sneezing and coughing. And the airway will start to narrow, thereby making it difficult for air to move out freely.
So what are irritants that could trigger an asthma attack?
The furs of pets like cats and dogs, pollens from flowers, trees, and grasses, fumes from the kitchen, dusts, perfumes, emotional stress like breaking a bad news or an incredible news, extremes of temperature, like a very cold weather, exercise. All these are well-documented triggers, and more than one irritant could trigger an attack. Let me share this little story with you. Scott. Yes, Dad. Quickly go check out the mailbox outside when you're done eating. Okay, Dad. Scott. Any mail in there? Urchin. Her coffer. Son, is everything okay? My chest is tight. I really can't breathe well. Her coffer. Daniel? Get me Scott's inhaler and my car key now. Son, we're here now. Relax, you'd be just fine. Everything is alright now, Mr. Scott. Thanks so much, Dr. Mark. Thanks for today, Dad. So as you can see, Scott's attack could have been triggered by fumes from the kitchen where he was eating, from pollens from the trees and grasses outside, or from the dusts in the mailbox.
So, how can the attacks be prevented?
Asthma attacks can be prevented by 1. Ensuring good housing condition. Rugs are not to be used in their rooms, because rugs retain dusts and releases dust when they are being cleaned. Floor tiles or floorboards are way better, because they do not retain dust and are easy to clean. Plastic blinds are also preferred to cotton for the same reason. 2. Rooms must be well ventilated. 3. Avoid being around where people smoke. 4. Exercise like swimming has been proven to improve the condition, if the associated trigger is not exercise. Ultimately, the best way to prevent it is to identify your own irritants or triggers and start to avoid them.
How should we respond when someone around us is having an asthma attack?
Always be on the lookout for a known asthmatic. Because when they have attacks, they might be too breathless to talk, due to rapid breathing and coughing. They might be sweating, and their lips and nail might be turning bluish. All these signs are life-threatening. Call around for help and check around to see if they have their inhaler around. If found, remove the cap, shake the inhaler. Sit the patient straight, gently tilt their head backward. Ask them to breathe out first. Then place the inhaler in their mouth and ensure that the mouthpiece of the inhaler is completely sealed by the patient's lip. Just as they begin to breathe in, Press down the canister to release a puff of the medication in their mouth, and tell them to continue to breathe in. Remove the inhaler from their mouth, and tell them to hold their breath for 10 seconds before breathing out. Then wait for 30 seconds to 1 minute after every puff before administering the next puff. Get him or her to the nearest hospital as soon as help arrives. The work of the inhaler is to open up the narrowed airway so that the patient can breathe well again. And the procedure is the same if the patient is to use the inhaler by themselves. I have a clip from CDC on this. Let's take a look.
Using a metered dose inhaler. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Without the inhaler, take a breath and breathe out all the way. Hold the inhaler upright. Put the inhaler in your mouth, above your tongue, and between your teeth. Seal your lips around the inhaler. Begin to breathe in slowly. Press down on the inhaler one time and keep breathing in. Hold your breath for 5 to 10 seconds. Open your mouth and breathe out slowly.
Wow, this is so cool.
And that was exactly what Scott's father did on that day that saved him.
So what's your final words for our viewers today?
Final words? Asthma attack is not a pleasant experience and could be life-threatening if it persists. Good news is that it can be prevented and adequately managed to a point that the number of attacks would be reduced to the rarest minimum, through your cooperation with your doctor.
And so that's it on today's show. Thanks to everyone out there for watching. And special thanks goes to Dr. Mark, alongside